Hi, it's Dr. Lauren Allison with Master the Body again, and this is the second video in the three-part series of breathing exercises for anxiety. Then the first video was all fours. Now we use 8 counts, except for the very last one, which is only 4. Now, if you decide to count as 1/1000, it'll look something like this. Holding in. Exhaling. Holding out. And repeat. It's a little bit longer, a little more difficult, if you're not used to doing breathing exercises. Now, if you did any practice of the first part video of this, you'll notice a different tier of feeling moving to these longer counts. That is on purpose, and in the third part series, I'm going to show you another different pattern, somewhat similar to the first pattern, and somewhat similar to this pattern, that will increase that sense of stability in your mind. And the reason why we do this is that not all breathing patterns and bodies are the same. What we need are multiple tools, and that's why I wanted to make this a 3-part series. What we're doing is we're using these as learning experiences to kind of find out where we hold our breathing because you're individual, because you're different than the person next to you. And also, very important, I want you to think of these as a framework. They're not hard and fast numbers that you have to adhere to and force yourself to. I have to do it exactly, in these counts for 5 minutes. You have to learn what the best pattern is for you. What these techniques do is give you the opportunity to kind of learn about yourself. One of the biggest stumbling blocks people run into is that they think that they have to do it exactly this way. Or I have to breathe through my nose, or I have to breathe through my mouth, or I have to belly breathe. And I would urge you to forget all of that. They have their place, for sure. But the main thing is that you are breathing and that you are doing some technique. If that's the technique that you like and it works best for you, then do that. If it's breathing through the nose, or do one that's breathing through your mouth if it's best for you. You have to find what works for you. Anytime people get uncomfortable, people will sometimes remark, "Oh, I almost feel like I'm starving for air." That's okay to a point, because you're learning to control the pattern. Being slightly uncomfortable is actually a good thing. They're exercises. But of course, with any exercise, you have to come at it in a way that you're comfortable with it. Breathing exercises are very powerful. Hopefully this helps you. Subscribe to the channel if you like. Thanks for watching.